Mr. President, I rise today in support of emergency supplemental funding for federal efforts to combat the impending threat of the Zika virus. Reports of the spread of this virus are concerning, and not just for public, actually they're troubling, and not just for public health officials, but for many Americans who are reading about it in the paper and seeing coverage on the news almost by the hour. Families are reconsidering vacations they had planned, especially to more tropical locations. And as we approach the mosquito season, people are understandably worried about how this outbreak will affect them and their families. Not just to go on a vacation or go camping, but literally to go outside and have a cookout or eat out on the porch. We're going to need to continue working to fully understand and combat the health risks that are posed by Zika. And just like with our response to Ebola, our response to Zika must be an all-hands-on-deck effort. In February, President Obama submitted a $1.9 billion emergency supplemental funding request to Congress to bolster programs and to activities which would curb the spread of this virus. And given the real threat posed by Zika, I support the funding levels requested by the President. I intend to vote for the amendment offered by our colleague from Florida, Mr. Nelson, which would fully fund this request. And with that being said, I understand that a bipartisan agreement on funding has been reached between Senators Blunt and Murray, which would provide $1.1 billion toward the Zika efforts. I appreciate their hard work in negotiating this language, and I'm going to support their amendment as well, so that our nation's public health officials can take all necessary actions to combat the spread of this virus. The Zika virus has spread explosively throughout Central America and South America, as we've heard. In fact, it's already reached Puerto Rico and other U.S. territories, and is expected to spread further north as the weather continues to warm. Researchers have learned much about this virus in just the last couple of months. Their findings are indeed troubling. Last month, the Centers for Disease Control and Prevention announced there's now enough scientific evidence to confirm what many have long expected, and that's the Zika virus is a direct cause of severe birth defects. Further complicating matters, it now appears that the mosquito primarily responsible for transmitting the virus has a wider presence in the United States than we had originally thought. I got two maps here. We're going to look at this first one here. Colors look blue, not good. Orange is less dangerous, less threatening in terms of the mosquitoes. And the combination of the blue and the orange is probably, if you look at it, the combination of blue and orange, it means that the two most worrisome mosquitoes are going to be really covering about the southern half of our country this summer. These areas up here to the northeast, to the Midwest, up there to the northern part, somewhat less troubling, but my state's right here. Mr. President, your state is right over here. Mr. Nelson's state is right here. The only person on the floor who looks like they're going to escape is Maine. Senator Collins is here. She's in the clear, maybe, but she's here to help lead the fight to make sure that we're all in this together, and we're looking out for each other. We've got another map. I just want to show another map. Major cities across the East Coast, including right here in District of Columbia, right up here, could be hit hard by the Zika virus, hit hard. With mosquito season upon us, and with more than 500 travel-related cases already diagnosed within the continental U.S., we must be prepared for the possibility of outbreaks in some parts of this country. That's why I was glad to see President Obama and his administration take an early and a proactive role in addressing Zika. And some of the actions already undertaken by federal agencies include assisting state and local governments in mosquito control efforts and ensuring that local health officials have the equipment that they need to test people for this disease. We also know that promising advances are being made in medical countermeasures and vaccine development. To date, these efforts have required the transfer of resources from other priorities, as we know, and including Ebola. Last month, the Obama administration announced that it would redirect on an interim basis almost $600 million from other public health accounts to pay for Zika-related activities. I believe the President's made the right call in light of the circumstances and the dire threat that's posed by the Zika virus. Now, however, it is time for the Congress, this Congress, to do our job. It is my hope that we can come together and pass the amendment offered by our colleague from Florida, Senator Nelson, However, if we're unable to fully fund the President's request, I believe the funding provided by the Blunt-Murray Amendment will go a long way towards supporting the many efforts currently being undertaken by the administration to combat Zika. I urge my colleagues to join me in providing the funding needed to stop the spread of the Zika virus. Mr. President, I'll just close with this. When the President gave his State of the Union, I think right after the 2014 elections, he had up in the gallery, was sitting next to Mrs. Obama, some of the folks who helped lead the fight against Ebola in Africa. Some were doctors, nurses, others, people who developed vaccines and that kind of thing. But it was a proud moment for our country. It was about 3 months after the election, early part of 2015. And we were not threatened here by Ebola directly. I mean, they lost 40,000 people in Africa, in the western part of Africa. For the most part, there were a lot of hysteria and scare tactics actually used in the run-up to the election about Ebola here in this country. But the actual threat, in hindsight, was not that great. What we did is we reached across the world, and we invested a lot of our taxpayer resources to help people who were really in a terrible situation. Terrible situation. And we helped save literally hundreds of thousands of lives. Their lives, not so much ours, but their lives. This is different. This is different. And what we have at stake here is our lives and the quality of our lives. Quality of our lives. And the ability of women to bring in to this world healthy children, healthy babies. And it's not just us, but it's our friends to the south of us, in Mexico, Central America, South America, the islands like Puerto Rico and Cuba. We're all in this together. And this is an all-hands-on-deck moment. And we need a real good team effort. The United States is going to vote today. We're going to vote in the Senate on whether or not we're going to be really a full partner of that effort. And we need to be that full partner. We need to do our job. This is one of those days. I'm confident and hopeful that we will. Mr. President, I will yield the floor. I know the senator from Hawaii, which I don't think, hopefully will not be affected by this virus, but I'm happy to yield to her. Thank you.